Okay, so we have moved on to the hip thigh. So here's some of the stuff at the hip of the thigh. So obviously we have our cadaver here. I removed all the muscles, so we're really just dealing with the bones and ligaments in this particular video. So we got to orient ourselves. So obviously we're looking at an anterior view. So we have the pubic symphysis right there, a cartilaginous joint with the cartilaginous disc articulating between the two anterior points. We have this wonderful, let's see if I can get it. It's a difficult thing to I'm trying to get there. It is the inguinal ligament. So you can see how the inguinal ligament has that nice little space that allows for the passage of muscles, arteries, nerves, and veins, etc. Real easy to actually find. So we can palpate the anterior suprailiac spine. We can palpate the pubic crest, and that ligament sort of almost like a high wire just connects those two bony landmarks. But let's talk about the ligaments. And again, ligaments, all ligaments do are connecting bones. So once we understand what bone we're looking at, everything else becomes much easier. So we know this bone that's highlighted here, it's in the anterior aspect. That's got to be the pubic bone. So there's our pubis. We know this bone down here, which is going to take up the most inferior aspect of the pelvis, is our ischium. And then we know the bone that comes up there and basically makes up the entire superior is the ilium. So now we have the three bones identified and we see ligaments. It's really easy because all the ligaments are basically attaching to the femur. And you can see the femur's outline there. So all we have to do to name the ligament is we have to establish what bone of the pelvis it's articulating with. So we are going to take our Henry pen tool out, and we have this ligament up here, which is coming. So we know it's going to be a femoral ligament. It's coming all the way up to the ischium. So if we highlight it, you get rid of it. That should be our iliofemoral because it's going right there to the ilium. You can actually see the anterior inferior iliac spine. So that's our iliofemoral. We have, I'm going to rotate this a little bit, and we have this ligament right here, which is running again to the femur, and it's going to the pubic bone. So what ligament do you think that is? Pubofemoral. Again, very lazy. Anatomists are very lazy. And then we're going to have this ligament in the posterior side, right? Again, there's our ischium. So this ligament is our ischiofemoral as it comes across and inserts. So you can see all these ligaments here as they come, the pubofemoral, the iliofemoral, and the ischiofemoral. We can actually then go, and I don't know why it's here. Let me see if I can bring it back. For some reason, I lost my capsule. This doesn't have the femoral capsule, it just really has the ligaments. So from here, I'm going to take my femur. I'm actually going to remove the femur, and so that we can get an inside look at the acetabulum. So I'm going to go and I'm going to remove these ligaments also so we can get a better look inside. There's going to get rid of that. And right here, you can see, get rid of that ligament. There you go. So there's our wonderful labrum, which is deepening the socket. So there's our acetabular labrum. And you're going to notice that the acetabulum does have an opening right there. So you have a little bit of an opening, a gap in the bone right here and here. And so because there's a gap in the bone, what we have done is that there's actually a ligament now that's actually connecting there, that transverse acetabular ligament, which is providing almost like a hammock for the femoral head to sit in there. And then we have the ligamentum teres of the hip as the ligament inserts into the head of the femur. So that's our soft tissue ligaments of the hip. Make sure you watch the other video that goes through all the bony landmarks of the femur and the pelvis using the plastic models.